Right now, China is claiming success, but initially there were many flaws in China's coronavirus strategy, right? And those mistakes really contributed to a surge of transmission, right?
So I think the one thing we shouldn't forget is that what happens when something new arises is that it is just that, it's new. And I think in spite of everyone's preparations all around the world, and in spite of the fact that this kind of outbreak is not unexpected and it's not unknown to science, the precise rate of transmission of this particular virus seems to have been what's caught everybody unprepared. So I think if we look back at mistakes that have been made, what's really clear is that it's the very rapid rate of transfer through populations which is causing so much problems.
Steve, so the threat of coronavirus is diminishing in China, but at the same time, the government has continued to push hard to control what is said about itself. So you've had news being actively censored, citizen journalists have been detained, foreign journalists have been expelled. What else is going on there when it comes to this?
Well, if you look at the composition of the most senior organizations responsible for the virus, the leading small group for countering the virus, which was set up in January, you can see that the one area that the Chinese government wants most people on was not on public health or on the economy, but on propaganda. And that shows you that from the very, very beginning, the Chinese government put higher priority on controlling the narrative of how the Chinese government is dealing with the virus than actually dealing with the virus. And so we can see that once the Chinese governments have found themselves in a situation that they would be able to project themselves in a more positive light than how the rest of the world seem to be dealing with it, particularly the democracies, they have seized that moment and have controlled that narrative and have done so very effectively. And that's basically where we are. And therefore, we are all being directed to focus on how well the Chinese government has been dealing with it. I think we should all be pleased that the virus is more under control in China. We want to see that being under control everywhere in the world. But making that narrative and contrasting it is more for political purposes than for countering the virus.
Nicholas, China the last 2 days is reporting no new local infections. Is the threat now the threat of imported coronavirus infections?
Absolutely. Beijing, as of yesterday, had reported 65 new imported cases. And this is now the worry that China has, in that all the people are now coming, all the Chinese citizens are now coming back, particularly from Europe, transiting other airports around the region to get back into China and get away from the threat that they're now seeing in Europe, and bringing with them a lot more imported cases. But it's not just, obviously, China. Singapore had something like 40 new cases, of which 30 had been imported. Here in Hong Kong, we've seen a spike of roughly 16 new cases, of which I think 14 had travel history to them. So this is the next wave as far as China's concerned. But at least in terms of detection and tracing, because they're scaling down in terms of ongoing community-based transmission across China, they can redirect those resources, and usually fewer resources, towards tracking, tracing, and quarantining people who are bringing in the disease from other countries.
Al, what's the situation currently in Wuhan? Is it still largely under lockdown, or are some of the restrictions starting to be lifted?
So I'm not so familiar with the exact situation on the ground, but I think, to echo some of these previous comments, one of the things that everyone in the world needs to be really focusing on is trying to make sure that they absolutely maximize the resources that are available for things like testing and responding to these outbreaks, because I think that's going to become more and more clear that there's got to be the very best use of the resources that we do have, having established that it's very, very rapidly transmitted, and also secondarily that if there's a sufficient resource deployed correctly, that the number of cases can be kept under control. It's really vital that everybody puts those two things together and makes very best use of the resources they have.
Steve, human rights activists have been making the argument that the fact that China was able to lock down millions of people so swiftly with practically no advance notice, that should not be considered anything other than terrifying. What do you say to that?
Well, I think there is a lot to be said about that, and that is why I underline the case of Taiwan, where they have used a lot of the tests and track methods, but doing so respecting rights of individuals. And it has worked effectively in Taiwan, a country of something like 22, 23 million people. So it's not a small place like Hong Kong or Singapore. That shows you that even for people of Chinese heritage and Chinese cultural background, different ways of dealing with it can work very effectively, and you don't have to go to the very extreme way how Wuhan and Hubei province were being dealt with in order to contain the virus. I think the really important thing at the moment is that we need to think beyond national boundaries. It is a global pandemic. Until the last country with the virus has managed to contain it, we have not contained it. And therefore, looking at one province, one city having contained it or not really is not a very constructive way to confronting this challenge that we all, as members of the humanity, are facing collectively at this point in our history.
Al, it looked to me like you maybe wanted to jump in. You were nodding along.
I couldn't agree more. I think what we're seeing locally here in the United Kingdom is lots of things happening very, very quickly. But one thing that is really astounding me is the level of change that people are dealing with. So as mentioned, regardless of the political, cultural background, extraordinary changes are needed in individuals' behaviour. I'm not qualified to comment on how that change is achieved. But what I would like to say as a slightly positive note is that in spite of this huge threat and the fact that it is, as mentioned, it's an uncontrolled global pandemic at this stage, certainly what I see locally, and I think this is echoed from news stories we've heard around the world, is that people are rapidly responding to try and ramp up the capability. So when the resources for testing, for example, weren't as widely available, we are jumping and scrambling to increase that resource and make testing more possible on a larger scale. So I expect to see a lot more of this in the coming weeks and months. If you're living somewhere which has not been directly affected yet and you believe that it's something that happens in another country, that's wrong. This is happening everywhere now. And the sooner that people can respond and get measures in place and understand what's going on, the better chance we have of slowing this thing down.
Nicholas, advocacy groups have said that China's draconian measures did indeed slow down the virus, but it also came at a very high cost. So let me ask you your opinion on this. Have human rights become a victim in the battle against coronavirus?
I think that China was faced with a double worst case scenario. I think the Chinese CDC realized that the policy measures being implemented on the ground in Wuhan were going to be insufficient. And at the same time, Chinese New Year was looming, which is the single biggest annual movement of people. Those two factors combined with the increased global connections of Chinese cities to the rest of the world really left the Chinese officials with very little choice. Now, the quarantine measures worked. At the end of the day, they worked. Now, yes, you're talking about an authoritarian country where liberal ideas of democracy are not necessarily going to be present. But at the same time, the overwhelming focus after around the 21st, 22nd of January was in stopping this virus in its tracks. not just for the benefit of the Chinese people, but also to ensure that there was a degree of confidence in the Chinese system internationally. And this is, it has to be said, this is where we're sort of getting to now. The issue that we have going forward is to what extent that model is translatable into other political systems. And there I'm not sure it is, which is why, as I think all three of us have been saying tonight, that the Singapore, Taiwan, South Korean models, with their more advanced use of technology, contact tracing, and so on, perhaps represent a more translatable model and set of protocols for different countries going forward.
Steve, I want to talk for a minute about Dr. Li Wenliang, because his death sparked such a massive outpouring of grief in China, and it certainly worried the government because that was happening. So just in the past couple of days, China announced that it has now posthumously exonerated Dr. Li. They have issued a formal apology to his family. They've also apparently doled out disciplinary punishments to 2 police officers for their handling of the matter. How significant is that?
Well, it certainly is a step in the right direction. It would certainly be welcomed generally, but then the reality remains that the 2 police officers who are now being disciplined were doing exactly what their orders were. And what happened to Dr. Li did not just happen to Dr. Li, it happens to many others. And the issue there really isn't so much what happens to an individual doctor. The crux of the matter here really was that the party state systematically cover up. We're talking about at least 6 weeks and probably for 2 months when they knew about human-to-human transmissions, and they were being warned about it, and they, instead of doing something about it, cover up and allow that virus to get transmitted, and still are not sharing all the information that will enable all involved anywhere in the world to be able to understand better how the virus originated, and therefore put us in a stronger position to contain the virus and perhaps to prevent something similar from happening again, even if we can contain this wave of the virus. So yes, it's a good thing that they have apologized to Dr. Li for something that should never have happened in the first instance, but that does not represent a change in policy. It represents a change in public relations management.
Nicholas, let me ask you about Chinese President Xi Jinping. Is he going to be able to leverage this crisis to strengthen his grip on power?
Well, I think actually that question gets back to your previous question about Dr. Li. I think it shows, I think the state officials' reaction with the posthumous admonition being revoked, I think it shows that the Chinese state itself has become far more greatly sensitized to this issue and to the role of public opinion than they have been for previous outbreaks. And in that sense, I think what we're seeing is an attempt by the Chinese leadership to shore up public support, to acknowledge a significant enough breakdown of trust between the state and society, but at the same time, not a critical one. But instead, they're saying, okay, yes, we made mistakes. I mean, they're actually admitting to this as a way of mitigating the public opinion, the negative public opinion, which is circulating on social media, at least before it gets censored. And they're starting to try to implement this next stage, which sets up China for having successfully overcome the virus, as Steve was mentioning earlier on, and then beginning to shape that narrative into China succeeded here, and we can now be, if you like, a health power role model for other countries going forward.
Al, within China, many provinces shut themselves off to travelers from elsewhere. How much concern is there that the virus will reemerge once these barriers are lifted and people begin traveling across the country again?
This is the bit that's, you know, the grand challenge for the next foreseeable future, and I really think nobody has any clear idea how long this is going to take to deal with, whether it's China or any other country. If you can get, and it's exactly the same for some of these other countries which have responded in different ways but succeeded in controlling things, that you can suppress the fire, but there's still fuel there. So whilst there are people who have not been infected, and whilst there's no vaccine, what's really striking, sort of from a biological, virological perspective, is quite how quickly this virus spreads, combined with its, really serious mortality rate and sort of toxicity. What that means is that maybe we're going to get stuck in a position where people can either move around or they can be safe, but they can't move around and be safe. So I think that really brings on the next, challenge, which is to make sure that we learn from the systems that are working in terms of tracking and tracing and testing, how quickly and on what scale can we do that kind of tracking and tracing, so that we can start to plan for a future where we can reconnect and we can build up global travel and local travel, but suppressing this infection. That's going to be really difficult. And we haven't mentioned really yet, but there are many countries in the world which are really going to struggle even more with that, because either the way that their society is set up makes it very hard to do these things, or technologically they may not have the technology and the money and the resources to actually do this kind of testing.
All right, well, we're going to have to leave it there because we've run out of time. Thanks so much to all our guests, Nicholas Thomas, Steve Tsang, and Al Edwards. And thank you, too, for watching. You can see the program again anytime by visiting our website, aljazeera.com. And for further discussion, go to our Facebook page. That's facebook.com/AJ Inside Story. You can also join the conversation on Twitter. Our handle is @AJ Inside Story. From me, Mohammed Jamjoom, and the whole team here, bye for now.